What if I told you that every single night you drag yourself out of a warm bed, stumble through the dark, and sit on that cold toilet seat? It is not your bladder's fault. What if the real enemy is something so silent, so invisible, that your own doctor may have never mentioned it to you? What if the answer to sleeping through an entire night, uninterrupted, peaceful, deeply rested, is not a pill, not a surgery, not a painful procedure, but something so shockingly simple that when Dr. Waterling first revealed it to a room full of urologists in Geneva, 3 of them actually stood up and said, "Why did we not know this sooner?" Dr. Waterling, a bladder neuroscience specialist who spent 22 years studying why the human bladder misfires at night, discovered that your bladder is not broken. It is being lied to. And once you understand what is sending it false signals, you can shut those signals down permanently. Stay with me, because what I am about to share in the next few minutes changed the sleep of over 200,000 people worldwide, and it is about to change yours. Nocturia is a medical condition, not old age. Waking up 2 or more times per night to urinate is clinically called nocturia. It is not a normal part of aging. It is a treatable condition that millions silently suffer from. The bladder-brain signal system. The bladder and brain are in constant communication through the nervous system. When this signal system is disrupted by stress, inflammation, or poor habits, the brain misreads bladder fullness and sends false "go now" alarms. Fluid timing is everything. Most people drink the majority of their fluids in the evening. This floods the kidneys exactly when the body is preparing to rest, triggering excessive nighttime urine production called nocturnal polyuria. Certain foods and drinks act as bladder irritants. Caffeine, alcohol, artificial sweeteners, carbonated drinks, and spicy foods actively irritate the bladder lining, making it hypersensitive and triggering urgent, frequent urination, especially at night. Pelvic floor weakness is a hidden cause. A weakened pelvic floor cannot properly support the bladder. This causes the bladder to feel full even when it holds very little, leading to unnecessary nighttime trips. Magnesium and vitamin D deficiency are directly linked. Scientific research shows that low magnesium and vitamin D levels reduce bladder muscle control and increase nighttime urination frequency. Correcting these deficiencies can dramatically reduce nocturia episodes. What if waking up 3, 4, even 5 times a night to use the bathroom is not a life sentence? What if everything you were told about your bladder, that this is just aging, that this is just how it is now, that you simply need to accept it, was completely, devastatingly wrong? Tonight, we are going to talk about one of the most misunderstood, most ignored, most embarrassing problems that millions of people face in silence. Nocturia, the condition of waking repeatedly at night to urinate. And we are going to talk about how Dr. Waterling, one of the most quietly influential bladder researchers of our time, cracked the code on why it happens, and more importantly, how to make it stop. Dr. Waterling spent over 2 decades not in a hospital seeing patients, but deep in a laboratory in Geneva, studying the communication system between the human brain and the human bladder. What he discovered was not what anyone expected. He found that in people suffering from chronic nocturia, the bladder itself was rarely the problem. The bladder was healthy, the capacity was normal, the muscles were functioning. But the signals, the electrical nerve signals firing between the bladder wall and the brain's alert center, were misfiring in a cycle of panic. The brain was receiving false alarms, and the body was responding to alarms that did not need to go off. Dr. Waterling called this phenomenon phantom urgency syndrome, and his findings sent shockwaves through the urology world because it meant that the millions of people being prescribed medications, undergoing bladder training exercises, even going through surgical procedures, were being treated for the wrong thing entirely. Now let us understand something very fundamental. The human bladder, when functioning correctly, should comfortably hold urine for 4 to 6 hours during sleep. The body has a beautifully designed hormone called ADH, antidiuretic hormone, which tells the kidneys to slow urine production at night. This means biologically you should sleep through the night without needing the bathroom. So when you are waking up repeatedly, something in that elegant system has broken down. And the question is, what? Dr. Waterling's research pointed to 4 primary culprits, and not one of them was age. The first was fluid timing, not how much you drink, but when you drink it. When a person consumes the majority of their fluids in the 4 hours before bedtime, the kidneys are forced to process and produce urine in exactly the window the body needs to rest. The simple shift of front-loading fluid intake, Drinking more in the morning and early afternoon, and cutting fluids sharply after 6 in the evening reduced nighttime bathroom trips in his study group by an average of 62%. 62%, without a single medication. The second culprit was bladder irritants. There are certain substances that do not just pass through your bladder, they inflame it. They make the bladder wall hypersensitive, so that even a small amount of urine triggers a desperate, urgent signal. Caffeine is the most well-known. But Dr. Waterling's research specifically flagged artificial sweeteners, those chemicals in your diet drinks and sugar-free foods, as some of the most aggressive bladder irritants ever studied. People who eliminated artificial sweeteners from their diet reported a dramatic reduction in nighttime urgency within just 2 weeks. 2 weeks, no prescription needed. The third culprit was something Dr. Waterling called mineral depletion, and this is where his research became truly shocking. He analyzed blood work from over 4,000 nocturia patients and found that 91% of them were deficient in magnesium. 91%. Magnesium is not just a mineral for your muscles and your heart. It is directly responsible for regulating bladder muscle tone. Without adequate magnesium, the bladder muscle, the detrusor muscle, becomes overactive. It contracts when it should not. It fires signals when it should be silent. Correcting magnesium deficiency with targeted supplementation combined with vitamin D, which helps the body actually absorb and utilize magnesium, produced results in Dr. Waterling's trials that were described as nothing short of remarkable. Patients who had been waking 4 and 5 times a night were sleeping through to morning within 30 days. The fourth culprit was stress hormones. This one surprises people. Cortisol, the body's primary stress hormone, when chronically elevated, disrupts the production of ADH, that nighttime urine-slowing hormone we discussed. This means if you are going to bed with unresolved stress, with a mind still racing from the day's anxiety, your body is not producing enough ADH. Your kidneys keep working at daytime speed, your bladder fills faster, and at 2 in the morning you are stumbling to the bathroom. Again, Dr. Waterling introduced a 15-minute pre-sleep wind-down protocol into his clinical trials. Not meditation, not yoga, simply a structured breathing and mental offload routine, and found that it measurably increased ADH production within just 1 week of consistent practice. What makes all of this so powerful and so infuriating in the best possible way is that none of these solutions are complicated. None of them require a prescription. None of them require a doctor's appointment. They require knowledge. They require someone to tell you the truth about what is actually happening inside your body at night. And that is exactly what Dr. Waterling dedicated his career to doing. Not for fame, not for profit, but because he watched his own mother wake up in exhaustion night after night for the last decade of her life, and he decided that no one else's mother, father, spouse, or child should have to live that way. Your bladder is not broken. It is not betraying you. It is responding to inputs. The wrong fluids at the wrong time, the wrong foods irritating its lining, the missing minerals it needs to stay calm, the stress hormones flooding your system at the exact moment your body is trying to rest. Change the inputs, and you will change the output. Every night of broken sleep costs you more than just tiredness. It costs you focus, immunity, mood, memory, and years of quality life. But you now know what most people will never be told. That nocturia is not inevitable, not permanent, and not something you simply have to live with. The path forward is clear. Adjust when you drink, eliminate what irritates, restore what is depleted, and calm what is overactive. Your bladder will follow, your sleep will return, and you will wake up in the morning, not at 2 a.m., feeling like yourself again. Thank you so much for giving this your time and attention today. That itself tells me you are someone who refuses to accept discomfort as their permanent reality. And that is the most important first step. You now have the knowledge. Go use it. Sleep well tonight. You have earned it. Good luck. Your best sleep is closer than you think.